This COVID-19 infection control and occupational health Listen to the Experts video series was produced by the CSIR. This video clip was produced in support of the South African National Department of Health in its fight to reduce the transmission and impact of COVID-19 on South Africa's healthcare sector.
Good day to you. My name is Rajen Naidoo. I'm Professor in Occupational Medicine in the discipline of Occupational and Environmental Health at the University of KwaZulu-Natal, Durban. COVID-19 impacts in the workplace and among workers in a number of ways. First, is a problem where workers are more likely to acquire the disease, or the disease is more likely to be transmitted amongst workers. Secondly, workers may experience more severe outcomes of the illness and therefore have more serious consequences such as hospitalization, admissions to intensive care units, as well as death. And then thirdly, workers are placed in a difficult situation when they experience what we refer to as the post-acute sequelae of COVID-19 infection. So I'm going to speak about these three items today. So let's start with the first one, COVID-19 as a workplace disease. So we know that among healthcare workers who are exposed to people with the infection, they're at greater risk for developing the infection themselves. But in certain other places, workers are also at increased risk for acquiring the infection. And workers can be at increased risk for a number of reasons. Firstly, because workers have to, particularly blue-collar workers, who have to travel for long periods of time in public transport getting to their places of work, they're placing themselves at increased risk in those modes of transport. Secondly, workers working in certain types of settings, such as congregate settings, if you're working in prisons, etc. And if you're working in close proximity with your fellow workers. These are situations like workers in the mines, for example, having to stand for long periods of time going down in shafts to the mine face, places them at an increased risk. The third category of workers who are at increased risk for transmission are those that are client-facing. Large numbers of workers in the public sector who service clients, who service the general population, place themselves at increased risk. And then of course we have the workers in the retail sector, in the food sector, particularly restaurants, where they're facing clients whose status is not always known. So these are the conditions under which the infection can be transmitted to them. So then we come to the point about COVID-19 as an occupational disease. Very early in the epidemic, around April, May last year, the Compensation Fund in the Department of Employment and Labor declared that workers acquiring COVID-19 as a result of the work that they do can be compensated. South Africa became one of the very few countries that recognized this in a legal context and was prepared to compensate workers. So using very strict criteria, it was determined that if you could show evidence that as a result of the work that you were doing, you acquired the infection, so it was defined as a workplace acquired infection, which was a departure from what we previously know the compensation system to work as, which is an occupational disease, which meant that the disease is caused by the workplace. The Department of Employment and Labor and the Compensation Fund defined this as a workplace acquired infection. So this meant that if you could show that you were exposed in the workplace to a person, to a fellow worker, or to a client who had the disease, then you are likely to get compensated. I don't want to go into the details about how the compensation would apply in different settings, but largely you would be compensated for loss of income as a result of being off work for a period of time, and it will also have provided you with medical benefits for the time that you were ill. Healthcare workers need to bear in mind that if they contract the infection as a result of their work in a healthcare facility, under the compensation law, it is considered to be workplace acquired. Moving on to the next aspect, and that is the workers being at increased risk for severe outcomes of the infection. As we all know, we've all learned this over the past year, everybody who gets the infection, a large number of people are asymptomatic. Some people become symptomatic, but they have mild infection, meaning that they don't need to go for further health care, seek health care. And then you have people with some level of moderate infection where they have to go into a hospital for oxygen supplementation, and then you get more serious outcomes such as admissions to the intensive care unit, and of course, sadly, in some instances, death. Now the question is, are workers at increased risk for these more serious outcomes? In all honesty, we don't know the answer to that absolutely. There's been 1 or 2 studies done in the international context which suggest that yes, workers may be at increased risk in different working settings. But what we do know is that there are certain risk factors for these more serious outcomes. And in the general community, we know that if people are of older age, if people have comorbidities such as chronic respiratory diseases, diabetes, HIV, particularly if these conditions are not treated or poorly treated, then these individuals are likely to have serious outcomes. What we do know that the working environment increases workers to have some of these comorbidities. We know, for example, that workers in the mining industry are greater risk for interstitial lung disease, particularly pneumoconiosis, in the mining industry, particularly silicosis. Interstitial lung disease in other contexts have been shown to have an increased risk for more severe outcomes. So it is likely that those workers who are exposed or who have silicosis or silica-related diseases in the mines may be at increased risk for the severe outcomes. Similarly, we know that workers in other settings, particularly in the healthcare setting, where they're at greater risk for acquiring TB, they may be at more risk for developing a more serious outcome of the disease of COVID-19 infection as well. What requires further research going forward, because of the science would suggest that there is a immunological reaction associated with COVID-19, it is possible that those workers who are exposed to sensitizing agents in the workplace, those workers who are exposed to agents that are likely to cause diseases like occupational asthma, occupational dermatitis, etc., may be at increased risk because of the corresponding immunological reactions associated with the COVID-19 infection. So that's the second point. Workers possibly at increased risk for severe outcomes. The third aspect that I wish to speak about is what we now refer to as the post-acute sequelae of COVID-19 infection. This is previously, or this is even currently referred to as long COVID. What we have seen is that workers or patients generally have had a range of outcomes from after acquiring the infection. These could be mild or asymptomatic, moderate, requiring some degree of oxygen supplementation, either at home or in a outpatient department, and then thereafter people being admitted to intensive care units, and of course then sadly people dying from the infection. What we've seen and what we started to learn more about subsequently is that even after the acute phase of the infection, people have consequences which delay their full recovery. These are referred to as the post-acute sequelae of the infection. The challenge for us among workers is that this may delay their return to work. This will also therefore impact on their ability to get an income during the days that they're off work. The question is whether this, if it is considered to be work-related, will be covered under the Compensation Act. At this point in time, the stakeholders are still debating how this would be approached. What becomes the next important matter is the management of these workers who are presenting with post-acute sequelae of COVID-19 infection. The responsibility here lies with the management in these different workplaces, such as healthcare facilities, where the senior management needs to ensure that workers are referred to the occupational health services, are managed by an occupational health professional in making the decisions about their ability to return to work. And this could be a return to work, their normal work, or return to work appropriate for their level of fitness at that point in time. There are a number of important outcomes or conditions that are associated with the post-acute sequelae. Obviously, the most important that we see is the respiratory problems, and these are mostly with people who have had originally a respiratory infection and pneumonia associated with COVID-19. This then impacts on their ability to do heavier work, particularly if they're blue-collar workers, if they're porters in hospital settings, and their ability to move patients around from point A to point B. However, one of the other more important outcomes we've noticed for the post-acute stage is neurocognitive outcomes. And these could be as mild as persistent headaches, but what we've also seen is tiredness and also to some extent a poorer cognitive functioning, memory loss, and their ability to function in a high cognitive situation. In the healthcare setting, this is going to be particularly important because we're going to have high-level nurses and doctors who are required under normal conditions to make important decisions about management of patients who may be affected. And therefore, returning these individuals to these highly stressed, highly cognitive demanding working environments needs careful consideration and can be best done following a appropriate and careful management by the occupational health practitioner in that particular healthcare facility. Thank you very much for your time in listening and watching this video. In closing, I'd like to remind you that my comments are directed to two groups of people in the working environment. It's those people that have management responsibility as well as those people who are workers on the front line, on the workplace floor. Managers have a responsibility to, one, ensure that workers who get infection are appropriately managed. If it is considered to be workplace acquired, compensated as per the Compensation for Occupational Injuries and Diseases Act. And then when they return to work, to make sure that they're properly assessed to determine their level of fitness for the work for which they have been employed, or for placing them in a more appropriate working space based on their level of fitness. Healthcare workers, whether you're a doctor, nurse, or a support staff within a healthcare setting, you equally have a responsibility. One, to make sure that when you do return to work, that you continue to observe what we refer to as the non-therapeutic interventions in preventing the spread of the infection, and also making sure that you report to your occupational health professional to make sure that you are appropriately assessed for the work that which you're employed for. Because you have a responsibility not just to yourself, but also to your fellow workers and to the patients that you're attending to in the healthcare setting. Thank you and best wishes.